What's up, everybody? Today, you are going to learn some of my personal favorite SI joint pain relief exercises and stretches. But first, you need to understand what is the SI joint. It's one of the only parts of the body that's named appropriately. Let me explain what it means. So the SI joint is the space, this pink right here, between the sacrum and the ilium. It's the joint space. And they named it great. Sacrum S, ilium I, SI joint. Hallelujah on that one. So that is what the SI joint is. Now, what it does, it connects the sacrum and the ilium together, and it's a very thick, rubbery joint. It doesn't move too much. So whenever you're jumping or running or walking, it's providing a little bit of cushion between the joints. Also, when you're walking between anterior and posterior tilt, it's providing a little bit of give. So it provides shock absorption, a little bit of it. There's a very slight movement with it, not too much. So then we go, what is SI joint pain? So SI joint pain is pain in the SI joint, okay? It's pain. Now, not just any pain. Listen, it's not your sciatica. SI joint pain is very specific. It's usually a sharp, a stabbing, an ice pick pain that sometimes can shoot downward. It's not going to shoot below the glute. I actually rarely see it shoot any more than this. Okay, that is what that SI joint pain is. And now generally you're going to feel it. People are going to feel it right in one of the dimples. So you're going to push your thumb on the bump right there, right on the inside of it. That's usually the telltale sign it's SI joint pain. And it's often only felt on one side. Maybe it's the right side. Maybe it's the left side. It can be both, but most often it's going to be one side. And what's going to aggravate that SI joint pain, like we said, there's going to be running, jumping, extension exercises. You're probably not going to like to do those. Those will hurt it. And you're likely going to get natural relief from the SI joint pain when you're sitting and doing things that are off of your feet. So the biomechanical causes of SI joint pain are, come on here, Kayla, let's show them together. Generally speaking, it is this. People that have hyperextension of the spine. Hyperextension. Meaning there is a normal pelvic tilt angle. Most of the people that have SI joint pain present with overextension of the spine. It's also called anterior tilt of the pelvis. And what that does is the more extended your spine is, the more compression there is upon the joints, not only of the back, but of the SI joint. Think about it. Extension is compression of the joints. Flexion is compression of the discs. So there's another one in there, a kicker, and it is going to be whenever there is a high-low hip. If you have uneven hips, the high hip side is most often the side that you are going to feel that SI joint pain on. The reason is because the low hip drops, the spine goes down this way, and when your spine, let's keep this hip low for a second, now tilt your body to the right. There you go. What happens here is this pushes the sacrum into the ilium and causes that extra compression. So it's dual forces, the extension plus the side bend. So I'm going to give you what you're looking for right now, which is going to be these relief exercises. Now, I'm personally mostly annoyed with these because it doesn't fix shit. Okay, but it is the fastest way for you to find relief is through relief exercises, mobility, stretches. I'm going to give you those, and I'm going to talk at the end about how to actually fix this shit so it doesn't come back. Okay, so let's go through some of my favorites. And guys, listen, you need to go through these, and you need to figure out which ones work for you. Kayla, you ready to show? Let's show and tell. Number one, pigeon. Start your leg off to the side. Try to keep this leg 90 degrees. You could do this on the ground. You can do this one, you lean forward. This one is opening up the glutes over here. It's opening up the piriformis. And what it's doing is creating some gapping. Generally speaking, the more you can gap the SI joint, the better it's going to feel. SI joint compression pain, the more you gap it, the better it's going to feel. The next exercise, let's show them hip flexor stretch, shall we? Okay, so on mostly the SI joint that's painful, you want to stretch that hip flexor more generally, but do both of them. So on her SI joint's the right one. So What you're doing is you're currently extending the shit out of your spine doing it. You extend your spine in everything you do. So it's not the stretch, but it's the way you do it. You need to back that ass up, tuck the pelvis underneath, shift the weight forward, hold that position, and now side bend over to here. So what that's going to do is decompress the hip flexor, which can help you reduce the compression on the SI joint. Next, classic child's pose. This is easy. You can do this one, you're all hungover, you're drunk, it doesn't matter. You wake up, take your knees super wide on this one, okay? And then you're just gonna sink back and breathe into it. This, because you are in extension that causes pain, this puts your spine in a flexed position. So the opposite of what's causing you pain is gonna help give you some relief. Next, let's do leg overstretch. Kaylin, let's show them in the back. This is Old Faithful. It's kind of like a half a chiropractic adjustment. You start on your back, and with you it's going to be, the right leg. You're going to pull the knee to the chest, swing the leg all the way over. I personally like to hook. I like to hook my foot behind my knee. It's going to be whatever gives you the most pull through here. Always on the exhale, you're going to try to pull yourself a little bit more. Okay, next, knees to chest while we're down there. Just show them knees to chest. Keep the knees wide. Listen, many times SI joint pain doesn't exist solo. If you have SI joint pain, you have more likelihood of having hip impingement in the front that you think is hip flexor pain. It's not hip impingement. This also goes with spondylolisthesis, spondylosis, and many other different conditions. So knees to chest is good. And then you can do happy baby. Hands on the outside of the foot, inside of the feet. Pull those all back. Generally speaking, this mobility ones you want to cycle through, perfect. You want to cycle through your favorite ones, add this to your morning routine or when you're in pain. Hold each stretch 30, 25, 30 seconds. Focus on that breathing. Those are very good. Those are my favorite SI joint pain relief exercises. Now, to the good shit, the shit that matters. Let's show them, okay? Let's keep this real simple. To fix SI joint pain requires you to realign your body out of the misaligned position into an aligned position, which means this. You're hyperextended back. You need to strengthen it and activate it into a more flexed position. And learn how to do your workouts from here. Learn how to walk in this position. That is going to be your number one skill to permanently improve SI joint. And that's going to involve transverse abdominis strength, rectus strength. In the glutes, notice the glutes are active with the pelvis tucked underneath. I'm going to give you a pro tip. It's to focus on the movement and not the muscle. Okay, the muscle can get confusing. So focusing on more spinal, we call this double flexion, is going to be the first thing that you should do. Secondly, getting into the hips and the glutes is to learn how to hold that double flex position and then to extend your thigh from that position into different glute exercises. There you go. She's like, what is he talking about and doing? You got it, exactly. So now, to address the uneven hip, what happens is, let's turn this way. With the uneven hip, oftentimes, let's just say you're on her left ankle rolls in, her knee rotates in, ankle, knee in. What it causes, this misalignment of the lower body causes the hip to drop. Now, with the uneven hip, you're likely going to find that the low hip is the weaker leg. The low hip represents the ankle that's rolled in, the flat foot, the knee that's rotating in. And what that does is it creates an angle here, and that angle is not a straight line, which causes this hip to drop down and causes the body to shift the other direction. So to improve this requires arch strengthening, ankle strengthening and alignment, knee strengthening and alignment, but that's going to elevate that hip up. So in a nutshell, you just have to reverse what the hell the root cause is. And most of you, it's that extension in high hip. And by strengthening and activating the movement to create realignment, you're going to find those long-term gains. Now, that's not in this video. That's the first 90 days is our back and core program level 1, hip and glute program level 1, knee, ankle, and foot program level 1. Other possible contributors, kyphosis of the upper back, that's shoulder and arm program. Kyphosis can cause this, and your body can compensate with extension. So those are definitely other issues to explore, but all you need to start with the back and the core, improve your alignment there, That's first and foremost. And then I'd likely recommend you move downward in the ankle and foot or upwards in the shoulder. All that's explained inside of our membership. So take a look at it. There's links all over the place, and there's links to more exercises if fucking 6 wasn't enough for you. There's links all over the place. Oh, and if you made this long, make sure you subscribe and comment on this thing. Okay, that's the least you could do to show your fucking appreciation for all this hard work. The end.